MPOX, once known as monkeypox, has emerged as a pressing public health concern, mirroring the ominous characteristics of the now eradicated smallpox virus. This disease doesn't simply bring fever and rash. It carries the potential to spread widely and impact vulnerable populations in devastating ways. Yet, despite its serious implications, MPOX is not widely understood. For instance, many don't know that MPOX can lead to complications such as eye infections, brain inflammation, and in severe cases, even death. This lack of awareness fuels its spread and complicates efforts to contain outbreaks. At a time when vigilance is essential, let's dive deep into the full story of MPOX, its symptoms, causes, spread, and the critical steps each of us can take to prevent it. As you read on, don't forget to support our mission to share vital medical insights. Hit like, leave a comment, and subscribe to Dr. My, sharing medical knowledge on YouTube to stay updated on health topics that matter. MPOX, a viral illness, belongs to the orthopoxvirus family, making it a cousin of the once dreaded smallpox. Although less severe than smallpox, MPOX brings flu-like symptoms such as fever, chills, headaches, and muscle aches, followed by a unique rash that progresses from red bumps to painful blisters. These lesions can appear on almost any part of the body, from the face and mouth to the hands, feet, and genitals, and can take weeks to heal fully. This protracted recovery period, along with the scarring and discomfort it brings, highlights the physical toll of the disease. Historically, MPOX has been endemic to certain regions in Central and West Africa. However, in recent years, outbreaks have occurred in areas far beyond its traditional borders. The global outbreak of Clade II MPOX, beginning in 2022, reached numerous countries worldwide, including the United States, which saw a spike in cases. Unlike other viral illnesses that tend to resolve quickly, MPOX can linger, with symptoms sometimes lasting up to 4 weeks. This extended timeline and the potential for complications emphasize the importance of prevention and early detection. There are two primary subtypes, or clades of MPOX, Clade I and Clade II. Clade I, more common in Central Africa, tends to cause more severe illness and has historically had higher fatality rates, though recent outbreaks have seen somewhat lower mortality. Clade II, prevalent in East Africa and responsible for the recent global spread, generally causes milder illness and has a lower fatality rate, yet still represents a significant health risk. Since the beginning of the global outbreak, over 102,000 cases of Clade II MPOX have been reported, a sobering statistic that underscores the need for increased awareness and vigilance. The symptoms of MPOX can vary widely. In some cases, individuals experience only a mild rash or a few flu-like symptoms, while in others, the disease manifests as severe and potentially life-threatening complications. Common symptoms include a fever, swollen lymph nodes, chills, muscle aches, and profound fatigue. Notably, one of the hallmark symptoms is the MPOX rash, which typically goes through stages. It starts as flat red bumps, then becomes raised and filled with pus, eventually crusting over and falling off. The rash's progression and spread vary greatly among individuals. Some people may experience widespread lesions, while others may see only a few blisters. MPOX spreads through various forms of close contact, direct skin-to-skin contact with MPOX lesions, as well as exposure to infected respiratory secretions, bodily fluids, or contaminated materials, can lead to infection. The virus can also spread through intimate interactions like kissing or sexual contact, making it critical to avoid direct exposure to MPOX sores or bodily fluids. Specific circumstances, such as being in a high-risk environment or sharing personal items, also increase the likelihood of transmission. Even animals, particularly infected rodents, can spread the virus through bites, scratches, or contact with contaminated materials. Given its zoonotic nature, MPOX remains a complex public health challenge that requires attention from both individuals and communities to curb its spread. Certain groups are at heightened risk of MPOX. For instance, recent global outbreaks have disproportionately affected men who have sex with men. Additionally, those with weakened immune systems, such as people living with HIV, individuals with chronic conditions, and young children, are more susceptible to severe cases of MPOX. Even individuals who do not fall into these categories can experience severe symptoms and complications if infected, so it's essential for everyone to take preventive measures seriously. MPOX can lead to severe complications, especially if left untreated or if contracted by high-risk individuals. Among the more serious complications are bacterial infections, which can escalate to sepsis, and ocular infections that can result in vision loss. The virus can also cause inflammation around the heart, brain inflammation, and respiratory distress. These potential outcomes underscore the importance of early diagnosis and vigilance in managing the disease. If you're finding this information useful, please take a moment to like, subscribe, and comment on Dr. My, sharing medical knowledge. It's one way to stay informed and support others in getting access to reliable health information. Unfortunately, there are no specific antiviral treatments from MPOX approved for widespread use. However, healthcare providers may prescribe antiviral drugs like tecovirimat or cidofovir for severe cases, particularly in patients at high risk. Some treatments, like Vaccinia immune globulin, are used for other poxvirus infections and may be considered from MPOX patients. In most cases, the body will naturally clear the infection within 2 to 4 weeks, though supportive care, such as rest, hydration, and over-the-counter pain relievers, can help alleviate symptoms. Prevention is the most effective defense against MPOX. Vaccination is a vital tool, especially for those at higher risk of exposure. The J1NOS vaccine, administered in 2 doses 28 days apart, is recommended for adults who are at high risk. In addition to vaccination, basic hygiene measures such as frequent hand washing, avoiding contact with infected individuals, and disinfecting commonly touched surfaces can help reduce the risk of transmission. When in situations with a high risk of exposure, wearing personal protective equipment, like masks and gloves, is advisable. If you're wondering whether you should get vaccinated, consult with your healthcare provider to assess your risk. Vaccination can significantly reduce the chances of severe illness and is a critical tool for those who may be exposed to the virus. Staying informed on MPOX and similar health topics is crucial in today's world, and subscribing to Dr. My, sharing medical knowledge can keep you updated on the latest preventive strategies, treatments, and insights into emerging health threats. To recognize MPOX and protect yourself, it's essential to understand its differences from other viral illnesses like chickenpox and smallpox. While all three cause rashes, MPOX lesions progress differently and are accompanied by distinctive symptoms such as swollen lymph nodes, which are rare in chickenpox cases. And unlike smallpox, MPOX is less transmissible and typically presents a milder illness, though it's far from benign. In conclusion, MPOX serves as a reminder of the unpredictability and complexity of viral diseases. While MPOX infections are typically mild, its potential complications and the recent rise in cases demand our attention. If you or someone you know shows symptoms of MPOX or has had close contact with an infected person, seek medical advice promptly. Stay informed, take preventive steps, and protect yourself and your community by staying updated. For more information and in-depth medical insights, be sure to subscribe to Dr. My, sharing medical knowledge, your trusted source for critical health updates and advice.